Jai Gurudev, surrendering to the lotus feet of Pujya Gurudev, I, Dr. Shweta, take this opportunity to speak about the Department of Shalya Tantra, PG Studies, Shri Shri College of Ayurvedic Science and Research, and Hospital. So generally we have a notion in our mind that what is Shalya Tantra, and when we want to translate, it is something like it can be translated in the term of general surgery and orthopedics. So many people come and they inquire whether there is surgery in Ayurveda. So that is the basic question which arises in a common man's mind, whether surgery belongs to Ayurveda, because many of the people who comes to us, they feel that surgery does not belong to Ayurveda. So this is just to clear and just have a brief idea about that what surgery is and from where it was originated. Now let me take this opportunity to introduce a legend of surgery who is known as Acharya Sushruta, and he is also awarded with the name which is called as he was the first ancient Indian surgeon. So that is one thing which I would like to bring to the notice, that surgery belongs to Ayurveda and Acharya Sushruta is considered to be the father of ancient Indian surgery. So surgery evolved from Ayurveda. That is one thing which I would like to concentrate upon. Now when we have to speak, or I should tell you about the department, it is something wherein we also conduct all kinds of general surgeries as well as we have the facilities of laparoscopic surgeries. So this in turn is in collaboration with the anesthesia, like we have anesthetist in panel and it is going hand in hand. So the anesthesia part is taken by the anesthetist and it is completely safe to undergo a surgical procedure because it is completely ethical. Now, secondly, what are the uniqueness of the department apart from this surgical point of view? I would like to mention here, there are few parasurgical procedures which have gained popularity over the years. Mentioning a few, I would like to say one is called as Kshara Karma and Shara Sutra. So now the world is knowing about Shara Sutra. There is a mentioning of this particular Shara Sutra as the term as a medicated ceton in the great textbook of surgery which is known as Bailey and Love. So it is in the 21st edition of Bailey and Love. There is a mentioning. So that much popularity this Shara Sutra procedure has gained. Now what is this Shara Sutra procedure or Shara Karma procedure? Shara Sutra is something which is like a medicated ceton or which is an alkali ceton which is basically used for the treatment of fistula. Now fistula is a very complex disease and we have also succeeded in getting results or avoiding the recurrence in this case of fistula cases. Most of the time what cases we get is these are the recurrent cases which has already undergone surgery according to other systems or by allopathy surgery 5 to 6 times, even 5 to 6 times or more than that also. Even after that we could succeed, and till today with this Shara Sutra and Shara Karma, many of the people, that is I could quote, that is approximately 10 to 15,000 of the cases we have successfully treated with the help of this Kshara Karma and Shara Sutra. So these are the two lines of treatment which are one among the parasurgical procedures, and they are very specific to anorectal disorders. So not only fistula, this was one to mention. There is also other disorders like fissure. When we talk about hemorrhoids, all such disorders can easily be tackled with the help of the Kshara Karma and Shara Sutra. So this is a unique treatment which is available in our science, and as I rightly mentioned, 10 to 15,000 of the cases approximately till today have also been benefited with this particular treatment. Now the second one to quote is something which is called as bloodletting therapy, and it is called Rakta Mokshana in Ayurveda. Few of you might have heard about leech therapy. So leech is something, okay, what is this leech therapy? When we think about it is something, it is a medicated procedure. Leech it is used for the medicinal purpose, or it is for the therapeutic purpose. The leech is used, and that is the medicinal leech which is non-toxic in nature. That leech is procured and then it is used for the many of the treatment procedures, specifically the inflammatory conditions, also any kind of joint pains as well as any skin lesions. In such cases, leech is said to be very, very helpful, because when we talk about Rakta Mokshana, leech therapy is one among the Rakta Mokshana procedure, wherein Rakta Mokshana is considered to be a detox therapy. So it's a kind of detox and it is specified only for the disorders which are blood-borne. Also, to add upon to this Raktamokshana, it is told by Acharya Sushruta that the diseases which cannot be cured by other therapies can also be cured with the help of Raktamokshana. So this is the uniqueness of this Raktamokshana therapy. Now coming to the third one which I would like to mention, which is gaining popularity day by day, it is called as Agni Karma. So nowadays when we see in the world is in hurry, and most of us are facing few of the issues either in the form of tendinitis, or it could be cervical vertebral disc prolapse, or it could be lumbar vertebral disc prolapse. So in brief, it is something like musculoskeletal disorders. These musculoskeletal disorders, they present themselves with the pain. So the pain perception by the patient which is happening because of this nerve endings, that can be tackled with the help of therapy which is called as Agni Karma. So rightly mentioning Agni Karma, it is something like instant pain relief. So we say in Ayurveda is slow. There is a notion in general public, Ayurveda is always slow. So I would say this therapy Agni Karma helps in instant pain relief. So whatever kind of musculoskeletal disorders, pain disorders which we have, like rightly mentioning tendinitis, carpal tunnel syndrome, or any of the calcaneal spur, or to be very frank, Achilles tendinitis, or even in case of sports injuries, it is very helpful and it is going to be a wonderful treatment. And there is a mentioning about this treatment that whatever the disease we treat with the help of this Agni Karma, usually it does not reoccur, it never reoccurs. So that is the benefit of this particular therapy. Now another thing to add is, even though belonging to the department of surgery, what Acharya Sushruta says, whether we should perform surgery in all the cases? No. So there is a clear-cut mentioning of the diseases which are Shastra Sadhya Vyadhis. It is called as Shastra Sadhya Vyadhis. That means there are diseases which are called to be as they can be cured only with the help of surgery. So what Acharya Sushruta says, it is not wise to practice the surgery in the cases which can be treated only with the help of medication, but yet there is a need of surgery in the cases which are called as Shastra Sadhya Vyadhis, wherein the disease cannot get cured without the help of surgery, and it is rightly mentioned. But it is what he says also, there is no contraindication of any conservative line of management even in case of Shastra Sadhya Vyadhis. So rightly we say that even people who are facing issues of urinary system, specifically the ureteric calculi, renal calculi, and all other issues like prostate problems, all these treatments we usually have a conservative line of approach towards these disorders, and we are successfully treating these disorders. So we are able to at least 6 to 8 mm of the renal calculi can only be cured with the help of our medications. So that is one of the unique thing which we are performing here in our hospital. And also for the benign prostatic hyperplasia, which is usually there is a surgery which is rightly indicated. So depending upon the gradings, to what grade the disease has reached, we can always give a try to the conservative line of management even for the prostate disorders. Now there are people coming in search of the conservative line of management even whenever the surgery is indicated. In case of prostate disorders, as I was mentioning, there is PSA, prostate specific antigen. People are worried about it, how we can tackle, and when there is an increase in the value of this prostate specific antigen, people get worried, and you are also asked to go for any of the surgeries or biopsy is needed. We have seen that with the line of management, various protocols which we follow in the form of Basti and other detox therapies, it is also helping the prostate specific antigen to come down. So in brief or in the nutshell, this is about my department, even though there is a lot and there are more things to be done.